Hi, Dr. Mack. I am creating the video that you asked for our appraisal class. And the instrument I decided to do an overview on was the Beck Depression Inventory, also known as the BDI, because this was a manual that was available to me in the counseling clinic at UNT. So, Dr. Aaron Beck created this very valuable instrument in 1961 at the Center for Cognitive Therapy, also known as the CCT, on the campus of University of Pennsylvania at their medical school. And it is critical to note that this instrument was created solely for the purpose of measuring the level of severity of a client suffering from depression. It was not a diagnostic instrument. It was an instrument to measure the level of severity that a patient was suffering with the issue of depression. And it was obviously a screening instrument so that a questionnaire was handed out to the client, and this questionnaire listed 21 symptoms or behaviors that the client was to focus on and evaluate how they were feeling by circling either a 0, 1, 2, or 3. So the Likert scale, I believe is what it was known as, ranged from 0 to 3, with 0 being not at all and 3 indicating an extreme or severe emotion for whatever the emotions were listed. The first one on the list, I believe, is crying. The second one is pessimism. So the client was to take the emotion of crying, and in 1961, when this instrument was originally developed, they were to focus on how they felt in the past 7 days, including the day they were taking the test. And the revised version of the BDI, the second edition, had the client looking backwards over the last 2 weeks to indicate what their emotion may be. So this is how the scores were tallied up, with 0 being the lowest score and 63 being the highest number of points a patient could circle, with obviously 21 times 3 equals 63, and that would indicate an extreme form of depression where the red flags were definitely raised. The scale, though, would range once the administrator gives the questionnaire to the client, and all 21 emotions have 1 number circled per question, and no questions were to be skipped, obviously, so that the validity of the test was true to form. The scales, then they'd add up the points at the bottom, and a scale of 0 to 9 denoted a minimal form of depression. If the points ranged from 10 to 16, this suggested a mild form of depression. If the score ranged in the category of 17 points to 29 points, this denoted a moderate form of depression, and 30 points on up to 63 points indicated a very severe form of depression. So this was one way to gauge where the client was, and again, the severity or the level of depression being experienced. So this test was administered. It was very straightforward and very simple to take, and the cost was always within reasonable range. I think as of 2002, it only cost approximately $50 or $60 to take this test. And it can be administered orally or manually. So orally would illustrate the administrator holding the questionnaire with the 21 symptoms or behaviors and asking the client, okay, suicidal thoughts, 0, 1, 2, or 3, or loss of appetite, 0, 1, 2, or 3. And the client would go ahead, give their answer. The administrator would obviously add up the points at the end of it. And then manually was just the questionnaire being passed out and the client finishing up the test in 5 to 10 minutes. Those patients who did already suffer from depression would probably take a little bit longer to take the test because it was maybe they were bordering on, do I circle a 2 or a 3? How am I feeling in the last week? How have I felt in the last 2 weeks? Depending on what year they did take the BDI. So the administration of the test, the interpretation of the test, and the scoring was all very straightforward and pretty easy to decipher or to unveil the level of depression being illustrated by the client. So the screening instrument was, when it was originally done in 1961, Dr. Aaron Beck had gone ahead and listed the 21 emotions of sadness, pessimism, sense of failure, self-dissatisfaction, guilt, punishment, dislike of self, self-accusations, suicidal thoughts, crying, irritability, social withdrawal, indecisiveness, body image change. Number 15 was work difficulty, 16 was insomnia, and 17 was fatigue. Number 18 was loss of appetite, 19 weight loss, 20 somatic preoccupation, and 21 loss of libido. Now, in order to stay current with the verbiage in some of these symptoms listed, number 4, self-dissatisfaction became, they dropped that, and in place of that, the verbiage was loss of pleasure. For body image change, that became, that was dropped as number 14, and worthlessness was the appropriate emotion given. Work difficulty, number 15, became loss of energy. Weight loss was dropped, and difficulty concentrating was put in lieu of that. Somatic preoccupation, number 20. I had to look up what somatic meant. It's a little difficulty. I thought it meant sleep. It does not. But that was replaced with tiredness or fatigue, so that the symptoms listed were more straightforward and easy to understand for the clients. So some of the verbiage was changed, but the symptoms or behaviors listed have always remained at the number 21. So that's what the BDI, which has literally been so crucial in the world of psychology and psychiatry, measuring the level of depression, measuring the severity of depression in particular individuals, has set the bar high and has been a prototype used for over 50 years. And with Dr. Aaron Beck being the well-known cognitive therapist that he was, I think it's also imperative to note that he always emphasized the fact that behavior and emotions are dictated through perception. So that a client that had any faulty schemas or a negative outlook on life, or had a self-hatred or a negative outlook on their future or the world around them, it was critical to go ahead and see that these people were treated for depression. And I think that pretty much sums up what the BDI represented. I also want to say Dr. Beck went on to develop the Beck Anxiety Inventory as well, also known as the BAI, and he did a depression inventory for children under the age of 13, since the BDI was only applicable to adolescents and adults ranging from ages 13 on up. So that is it. Thank you so much.